Many individuals experience scalp disorders that may or may not be associated with hair loss. So what are some of these conditions? The most common one is regular dandruff or flaking of the scalp. Now, individual with dandruff is just an inconvenience, more so than not. Using a shampoo over the counter is the most common cause. Most common way is treat it or to help. But those individuals are not the ones that usually end up in the dermatology office. There's usually itchy, flaky scalp. So that's one of the biggest things we see. An itchy, flaky scalp can be a sign of a condition called seborrheic dermatitis. It can also be a sign of a fungus or ringworm infection. So evaluating the scalp, sometimes taking a scraping to look at microscopically, can help tell whether antifungal treatment is needed or just something for the flaking and inflammation. Another common scalp disorder is bacterial infection. A person may have tenderness, soreness, irritation of the scalp. When examined, there may be pustules or pimples around the hair follicles with bumps, crusting, yellowy, and sometimes bleeding from scratching. So folliculitis is a scalp disorder that can require a variety of treatments, including oral or topical antibiotics. And another scalp condition is psoriasis. So many patients who come in, the first thing they walk in and say, oh, I have psoriasis of my scalp. At least 50 or 60% of these individuals don't have psoriasis. They have some other condition. But the psoriasis itself is usually pretty distinctive. It causes silvery plaques, scaling, thickening, and sometimes bleeding as well. There can also be an overlap of these conditions. You can have psoriasis mixed together with seborrheic dermatitis. That's called sebopsoriasis. You can also have itchy scalp where the scalp looks normal. There's nothing present on the scalp, and it's a condition called neurodermatitis where it itches from the inside out. And a person will usually scratch their scalp, and the hair will break off and cause patches, but it's another scalp disorder. So infections, bacterial or fungal, inflammations, psoriasis and seborrheic dermatitis, breakage, changes in hair texture, blistering diseases of the scalp are all part of other scalp diseases. And there's some more that are even less common than that you would be more knowledgeable about. I want to be part of the solution for helping individuals with hair loss get the professional care and guidance that they need. Go to NACMHP.org and provide your email address to get our free report and ongoing updates to be part of the community that helps solve this problem. Go to NACMHP.org, give us your best email address, and we'll send those reports to you right away and get you on the list.